join us on the conversation about COVID-19 and this deadly pandemic is Dr. Preeti Malani. She is the health officer and professor of medicine in the Division of Infectious Diseases at the University of Michigan. So great to have you with us on the Oakland County MegaCast, Doctor.
Thank you, Ronnie.
Let's just start off. We are just a few days out from Thanksgiving. CDC putting out a very alarming alert yesterday, encouraging so many people not to travel home. You're at the University of Michigan. I believe you have a college student. What should parents know? Should their kids come home? Should they keep them on campus? And we're a few days out, so these could be hard decisions for some parents to make, especially if their child isn't within driving distance.
Yeah, so Ronnie, these are like the decisions are difficult, and they're certainly difficult for my family, even with my son is a student at the University of Michigan. And just in general, like the holidays are this time where we want to get together with our friends and our neighbors and of course our extended families. And this year has to be a little bit different. You noted the CDC's comments earlier this week, which are pretty extraordinary, but basically saying don't travel and don't gather, especially outside of your own household. And again, I say this is that each family really needs to make careful decisions on how to celebrate safely, because there's an uninvited guest this year, and that's COVID-19. And these small household gatherings have been an important contributor to the surge we're seeing. And it's been, you mentioned the Michigan numbers, and it's astounding. A million cases in the country, new diagnoses in the past 7 days. I can tell you a little bit about what we're doing on campus. And again, this is a stepwise process, and what we've asked, our campus is it's a little bit different depending on what year you are. And most of the students living in the residence halls are our first year students. And of course we have graduate students and international students who are going to stay put, and this is home for them. But the ones that graduated last year during the pandemic and entered school during a very imperfect time, these are the ones that we're thinking about. And today it sort of marks the day of when the residence halls are sort of closing up this weekend. And we've asked them to practice enhanced social distancing, so being really careful about their contacts for the last couple weeks, and then to get departure testing, which is being done for free on campus. And again, testing is one element. It's not a guarantee, it's not an absolute, but we don't want to send people home to their home communities with active infection. And then when they get home, to quarantine further. And again, that sounds sort of extraordinary, but we're living in extraordinary times.
And I wonder if we could talk about the testing for a moment, because, so many labs are getting backed up right now because of the testing. So you're hearing conflicting information right now. Some people are saying if you don't have symptoms, don't get tested. But yet other people are saying, no, if you're going home or if you're going to travel, get tested. But we also know that test is a snapshot in time. How do you make these decisions with so many different, so much different information is coming at you?
Yeah, and it's complicated for me, and this is like what I think about really for far too many hours each day, so I can see where it's confusing to folks. So I will just say, if you have symptoms or you've had an exposure, you fall into a very different bucket. And testing there is something that's recommended, and it's treated a little bit differently. What you're talking about is testing without symptoms, so asymptomatic testing. And again, I think for students leaving a college campus where rates are higher and exposure is higher, and on our campus, actually, things have gotten a lot better in the past couple of weeks. We were in a different place back in October, and fortunately, numbers have come down. But as we're sending our students back to their permanent residence, to their families, potentially to vulnerable family members, we want to make sure that we're doing our very best to at least prevent. It's like one more safeguard, I would say. And again, campus is a different situation, and particularly living in a residence hall. For those of us who have been following pretty good practices and we're at home and we're worried, you certainly could get tested. Right now, that access is a little bit limited because so much testing capacity is going toward people who've been exposed or even have symptoms. testing is something that is evolving, and we have more access, but there's still not enough. And I was just hearing this morning that some of the area hospitals are again having supply issues. But I want to emphasize something that I see done, which is that people get tested thinking that they can go to a party or to a family gathering and be, quote, like clean, uninfected. And that is not the case. When you're mixing with someone outside your household, that you still need to follow the guidance of distancing and masks. And I know that seems odd for families, but this is an odd time, and this is about really preventing those devastating infections. And again, there's not one perfect way, and that's why the recommendation is to maybe celebrate virtually this year.
Yeah, when we think about, I know the CDC is saying if you're going to have some type of Thanksgiving gathering, do it outside. That's great if you live in Florida, but we are in Michigan, and next week I think the forecast is calling for 40-degree weather. Realistically, people are not going to be doing that. And so what do you do if you are feeling pressure from your family to attend an event? Because I think that is part of this conversation that no one's really having right now, is that how do you kind of contain that backlash from your family if you say, hey, I'm not comfortable coming right now?
Yeah, that's Ronnie, that's a really good point. And it is. I was born and raised in Michigan, and, Thanksgiving is usually, especially people who've gone to Detroit for the parade traditionally, or the turkey trot, it is always cold. And actually this year's a little warmer than most. But I agree, this isn't the summertime where you could be outside, but, you could be in your garage, you could open windows. You can do some things, you can eat separately. So I have a couple thoughts on this. One is that those family conversations, really have them ahead of time. And I know they feel a little unnatural and awkward, but really the lives of the people you love depend on them. Your own life might depend on it. So have those conversations, let folks know. I actually think people are reasonable. And we just don't know how to go about this. And I've heard all kinds of things from friends in the last couple of weeks, and do the right thing and make good decisions. I will say, too, that if you do gather in small numbers, some of the things you can do is keep the masks on and really try to eat and drink separately. Maybe eat and drink on your own, and then get together to just get together. Because the danger is when the masks are off and you're in close contact. And there are ways to try to prevent that, maybe to eat in separate rooms. And again, none of this is normal or natural or ideal, but this is about what we need to do at this point to prevent spread, because those small family gatherings have really contributed to the surge that we're seeing right now.
Can we shift a little bit to the conversation about the vaccines? I think once we have all heard this, general public people, we hear vaccine and we think, we're going to be able to get back to life as we once knew it. Your thoughts on the vaccine, and is a regular life down the normal, or is COVID going to be around from here on out?
Those are $1 million questions. I guess there's good news with the vaccine, and we've heard early data from Moderna and Pfizer. These are the mRNA. It's one particular platform, but the other vaccines that are still under study, that are in the late phase trials, use a similar part of the virus to create the antibody response. So I guess this is encouraging all along that hopefully there'll be multiple effective vaccines. The safety data are also reported to be very good. And I understand that Pfizer is going to the FDA today with their data, with the hopes of getting an emergency use authorization. And, that could happen as soon as a few weeks. So we're actually planning at the University of Michigan, the health system, in anticipation of having vaccine as soon as December, and how that's going to look, because we've never had to vaccinate this many people in the country, and certainly not during a pandemic. So excitement and lots to look forward to, but more information is still pending. In terms of where we're going to go with the vaccine, again, will be one element. And I like to emphasize this, that isn't going to be a moment of like, wow, the vaccine's here and now we're all back to normal. It's going to be a staged process. Now, I do think that Operation Warp Speed and all the resources of the federal government have put us in a good place where the manufacturers have gone ahead and made doses, millions of doses, hundreds of millions of doses of vaccine, and started with planning on how this is going to be distributed. My hope is that if we can contain the virus in the community, and this is why we can't just have out of control spread. There's lots of reasons, but this is one of them. We could eventually, with the vaccine, get closer to normal. And my hope is that sometime in 2021, maybe at the beginning of the school year, hopefully things will look closer to normal. But it's really going to depend on the basic mitigation factors until then.
Dr. Preeti Malani with us on the Oakland County MegaCast. She's a chief health officer and the professor of medicine in the Division of the Infectious Diseases at the University of Michigan. Dr. Malani, with that being the case, with the timetable that's associated with distributing the vaccine, after that timetable has surpassed and the vaccine has been out in the public and the general public is starting to get vaccinated, and we're seeing that finish line. Where is the finish line after people have been vaccinated? What is the medical community looking at? What will the government be looking at also from the medical community and the scientific community after a vaccine is distributed to be that benchmark, if there is a benchmark or a set of benchmarks that say, okay, now we're in a position where we have mostly contained the virus. It's not going to be as contagious necessarily or dangerously contagious further because of the vaccine and the effects of that on the general population. Where is that benchmark, and how long do you think after this vaccine is distributed that people should expect that timetable to last?
Yeah, these are great questions, and I ask these questions every day to myself and to others around me. So I think there's reason for hope, and I want to leave people with hope, because this has been such a hard year, and this is going to be a difficult holiday season for families. The fact that the vaccine efficacy numbers are so high means, like, the ability to prevent cases is in the 90-95% range. It means that we're likely to have a higher likelihood that we can actually get rid of this and have it to where the numbers are so small that it won't impair our day-to-day living. Now, getting to that point is going to take a while, but I am hopeful as to where that finish line is and what that looks like. A lot of unknowns, including the fact that we don't really understand, does the vaccine completely prevent disease, or does it prevent transmission? Do you get like a low level of infection? There's still a lot of unknowns that we need to work out. But I do think that finish line is there, but it's not going to look quite like what we think of a finish line. It's going to be sort of a slow stage process. And we also have to remember that, some people may not feel comfortable getting the vaccine. And so having good information, having honest communication, especially around the approval process, like what happened, how did it happen, so that people feel good about this vaccine.
Yeah, I also wonder, because obviously we have the vaccine for the flu, but the strain of the flu changes every day, and you wonder, is this going to happen with COVID-19 as well? But also going forward, when we're looking at the ethical side, are companies or businesses now going to require for people to have proof of a vaccine in order to maybe work or go to a sporting event, things of that nature? What are your thoughts on the possibility of that down the road?
Yeah, those are unknowns, and I think that probably some of the easy ones are if you work in the hospital, likely you will be required to be vaccinated, with very few reasons for exceptions. And frankly, that's the case with the flu vaccine, which uptake overall in the community is lower. I think residence halls, for example, thinking back to college campuses, military barracks, other places where you live in very close contacts with people, these are going to be the places where you really want to have high rates of vaccination. Schools, classrooms. So, my hope is that we get good information out, and that people take it at face value and ask the right questions. And frankly, everything that has been provided to date is really encouraging. I do know that the vaccine, when you first get it, the ones that have been talked about in the last few weeks, there are some side effects, and people have fevers for a couple days and their arm hurts, but that's short-lived. And again, we're comparing the risk of the vaccine and the side effects and inconvenience to getting COVID and potentially being left with illness for weeks, and obviously, the severe cases, hospitalization, and even death. So it's a trade-off, but that communication piece, and it's going to be from the news media. It's going to be from healthcare workers. It's going to be from vaccine manufacturers, the government, everyone, to really be clear and to address the concerns people have, because people are going to have concerns about a new experimental vaccine that was rushed in their view.
From a healthcare standpoint, I think one of the good things that maybe will come out of this was how the scientific community came together to collaborate on so many various different levels globally to try to come up with this vaccine. Do you think some of that will fall over into what we hope to be a post-pandemic time to help with vaccines for other diseases as well?
Yeah, I hope so, Ronnie. There are silver linings, and I think the collaboration, including the private-public collaboration, in this case, the entire weight of the federal government helping to move things quickly, that was necessary. The manufacturers have also been all in. There are a lot of smart, thoughtful, altruistic people who've been working on this since day one. I do hope that we can think about not just vaccines, but prevention in general and public health in general. We've been so focused on COVID, but there are a lot of other issues for our health, and whether it's heart disease or cancer prevention, or it's loneliness and social isolation. And I think shining a bright light on our overall health, because we're not a healthy community in all senses. And so I hope that science moves forward. I hope young people are interested in science, and especially public health. And I hope that spirit of collaboration does continue.
And knowing that, and knowing your background, how worried that COVID is just one virus? There could be another one that comes after this.
That is the worry. And one pandemic is one too many, but we need to be prepared with the next threat and not have this ever happen again. But we do need to have monitoring systems and to really rethink how we do things. And again, I think the public health people who are truly heroes with the work they've been doing with very limited resources, I hope that we can think about how to better fund and support and resource those lifelines.
Doctor, before we let you go, as someone who studies infectious diseases, looking at this new generation and the college students right now, they're having to learn remotely, and it's a different world. But yet, are you hoping that this crisis and this pandemic will spur interest in the healthcare industry so that we have more people ready to go on those front lines and be a part of the solution in the future?
Yeah, I hope so. I hope that is one of the silver linings. And again, health sciences are great. And whether it's in social work or in nursing or in pharmacy, or certainly medical, dental, whatever it is that you choose to do, to think about science and the beauty of science. I've had a pretty untraditional career, and I think I wouldn't trade it for anything. I mean, this is not a time that I would ever want to live in, but it's been there are silver linings. And I think for our young people, science is great and exciting, and however you choose to come at it, there is a place for you.
So before we let you go, just another minute or two, anything we maybe didn't touch on that you want to share with our listeners and our viewers, because when it comes to this pandemic and it comes to science, you are the expert. We're basically going off of the news headlines. And I wonder what it's like for people such as yourself with so much more knowledge than us in the general public, what it's like for you to go through this as well.
Yeah, it's been interesting, and I think it's been exhausting, but also exhilarating, and I think there's a real sense of gratitude for people. What I would say is that this isn't going to last forever. We are going to get better, so take care of each other, be kind, be patient. I think it's hard. We're all kind of raw from this. The other thing I would say, and I know that recently, and I'm sure you've talked about it, the pause to save lives, that we have to remember that the economy really depends on the virus being under control, that we can't have one or the other. It's not a false choice of let's just do things as usual and forget the virus, because frankly, people aren't comfortable being out and about if there's uncontrolled spread. But we can be in the middle. The two extremes are extremes. And what I want is for people to try to be in the middle, to try to reframe and to continue and find ways to continue to move forward, whether it's with work or school or with your social life, and to really be nice to each other and be civil and kind and really think about how much people are hurting right now. And I think Michiganders, we're like strong, robust people. Like, we're going to get through this winter, and hopefully there's going to be a new start in the spring.
And, Doctor, with that, one of the things I wonder is, so when the government does it, so like now we're in the middle of this 3-week pause, as they like to call it. But what happens at the end of the 3 weeks? If people go out and continue to live like they were prior, won't we be right back in the same cycle?
Yes, unfortunately we will. I think that is a concern. And so I think somehow explaining the why without it becoming this false choice between, this is a political choice or freedom or that this is, unfair. All of it's unfair. And this has been about difficult choices. But again, there can be no economy. There can be no society if we have people that are getting sick and dying. And again, we focus a lot on deaths and hospitalizations, and those are really important numbers. And fortunately, we've been a little bit better than we have in the spring. But we also see people who get mild illness who are young and healthy and who are sick for weeks on end. This isn't something that anyone wants. Many people have recovered, thankfully. But I think the idea is wearing a mask can actually produce incredible benefits to people. And again, just not being in big crowded places, sort of mitigating ourselves and finding places to live, finding a way to live that still allows you to have that important social interaction and allows businesses to continue. And I think finding ways to support each other through this. None of this is ideal.
We had heard earlier on about some of the college students basically having parties to try to get it so they could say, hey, I've already had it, I'm immune. And we are seeing so many more people, record numbers being tested and testing positive. Once an individual has the virus, what do you want them to know about once they're on that second edge of it? They come out and they're back to normal life. Can they still catch it and can they still spread it?
These are good questions, and there's still some unknowns in terms of what immunity means. And there have been descriptions of people getting infected again. Fortunately, it appears to be rare, but the rules are the same for you at this point. And that may change as we learn more. But right now, having infection doesn't mean you get to behave any differently. And, those stories about the college students trying to get infected, that may be the case. I think those are really a very small number. I think some of those stories were exaggerated. But, it's hard. Young people want to be with other young people. People want to be together. And I have also seen a lot of really responsible behavior with small groups, kind of people finding their social pod, because being completely isolated carries a lot of risk too. And so, again, it gets back to this idea of being in the middle and trying to moderate our behavior and finding ways to reframe interaction and move forward, but doing so safely.
Well, we so appreciate your time as well as your knowledge. Here on the Oakland County MegaCast, we're wishing you and your family a safe and very happy Thanksgiving as well. And again, we so appreciate your time. Thank you for being with us on the Oakland County MegaCast.
Thanks. Likewise to all of you. Happy Thanksgiving. People stay safe.